us live is Congressman Pete Hoekstra. Congressman Hoekstra is the ranking Republican on the House Intelligence Committee. Good evening, Congressman.
Hi, Greta.
Congressman, looking at the numbers in terms of how many people are in favor or opposed to the health care reform, at least as we suspect it's going to be this bill, because we don't know exactly what it's going to be, they've been pretty much constant for the last couple months. Why do you think that?
Well, I think the number is staying where it is, and it's not improving for the president, is because that the more that people learn about this plan, the less they like it. The second thing is they don't like the process. As Rush was just saying, it's going to be 4 years to implement the plan, but Nancy Pelosi and the leadership in the House, they make a mockery of the process by saying members won't even be given 72 hours to review this bill. And then I think the most dangerous thing to the president is I think the American people are losing faith in his ability to provide the leadership to lead this country on this issue and on other issues. And the best example for that is the decision that I think has been made and made public in the last couple of, or in the last day or so, saying, the General McChrystal sends a plan for Afghanistan to Secretary Gates. It's going to sit on the shelf until the president reaches a decision on a new strategy. But then this week, at the end of the week, he's willing to go to Copenhagen to make the pitch for the Olympics in Chicago. So people are wondering and believing that this president has his priorities mixed up.
Well, I think actually the thing that sort of caught my attention, many others, is that it's apparently General McChrystal says that he has only, in the number of days that he's been in that position, only spoken to the president one time, and he is the field commander in Afghanistan. And I think that probably, right, at least that caught my attention more, because who would know the story better than the guy who's actually there? But maybe the president has an explanation for that, and I look forward to hearing that.
No, that's exactly
anyway,
right. I mean, yep.
Go ahead, sir. Go ahead, sir.
I was going to say, no, that's exactly right. You've got the commanding general, and the commander-in-chief has only talked to him one time in the last 6 or 7 months. I mean, that is unbelievable when we've got troops in harm's way and things are not going well.
All right, let me ask you to go back to this health care for a second. This 78% of the American people apparently would like to have available to them the program that the members of Congress have. What is your health care program? How much? Do you have any idea how much you pay for it?
My health plan is the same as all other federal employees. I can go to a thick manual. I can go through there and I can take a look at what plans are available in Michigan. Then I can take a look at what plans are available in West Michigan, and I can choose among those 3 or 4 plans. And I believe that I pay about, I'll get you the exact details, I think I pay between $200 and $300 per month as my share of that plan. But I think that would be a great thing to investigate. Compare members of Congress's plans to the average union plan, to some private sector plans, so that we can see exactly how good the congressional plan is. And people always talk about this, but I think this is an area we could really dig down into, and I think would be very interesting. And I think a lot of people would be surprised. I don't think our plans, and I'm not complaining, but I don't think it'd be quite as good as what some people would believe it to be.
Well, I guess there we go back a little bit to the transparency issues that we'd like to a little bit see. I mean, people seem to think that might be a good standard, is whatever members of Congress have, and maybe that's profoundly expensive. I don't know what the matching federal payment is, but we
Greta will get this information and we'll have it for you in a week.
Great, but the other transparency thing is the issue that you brought up is that, and I think this is what really I imagine enraged the American people most of all, is that I think the American people would like to see this bill put on the internet so that we can, you people should be able to, since you're going to vote on it, but you know what, we should also be able to see this before this is voted on, and it takes nothing to feed it to the internet so that we can look at it.
We should have it at a minimum of the 72 hours. That's what we're asking for. That would give everybody in America an opportunity to see at least some of what's in this bill. The people who write this stuff can really bury some good stuff in it, but we would have a good top-line overview of what's in it.
And more importantly, is that I think unless it's written plainly so that we all understand it, we know that once it's going to be implemented down the road, is that the people who implement it aren't going to be able to understand it. Then they end up in court fighting about it, and then the judges have to try to figure it out, and then they're accused of being activist judges because they can't figure out what's written there, and then we have more problems. So it might behoove us to see what it is and make sure it's written so we all understand it. But anyway,
I know that you've been pushing for it. It's exactly what you should do.
Thank you, sir. Thank you, sir.
Hey, thanks, Greta.